and welcome to another episode of Healthy Perspectives. Cardiac arrest is a problem that we read about regularly in the newspaper, in the media. It's a global problem. Despite advances in preventative care, it still remains one of the leading killers of individuals globally speaking, whether it be in the hospital or out of the hospital, whether individuals have received resuscitative care or have not. Our concern today is with individuals who have not received resuscitative care, or what you may be familiar with being called CPR, while outside of the hospital. Today I have with me Mr. Marlon Destin. Marlon, you and I have worked together for a number of years, and you particularly working in the pre-hospital setting. Do you see a problem with individuals not receiving CPR prior to arriving into the hospital?
It has been an issue in the pre-hospital care setting. What you find is that a person goes into cardiac arrest, family members, they sit by, do nothing, bystanders, somebody collapses in front of them, and nobody does anything. So it is a serious issue.
You say people stand by. Now, here's a body, a loved one, lying in the street, lying at home, and nobody does anything?
Nobody does anything.
Why don't they do anything?
I think it's one, they don't know, or the other thing also is it's just education and awareness of what to do.
So basically then you're saying is that in your professional practice and opinion, people don't know how to do basic CPR, even in the home setting. Is it that people expect, well, the healthcare providers, they're the only ones that need to know CPR?
They believe that there are individuals who are professionals who should do this and should know how to do this, so they themselves don't need to do it.
Do you think people are afraid to do CPR?
I wouldn't say afraid. Some people a little bit tentative, wanting to do it because they think they may hurt the individual.
And that's understandable, because what are some of the things that you find happens to the patient when you perform CPR?
With professionals who do it every day, you have broken bones, and that's one of the major causes that can happen. If your hands are not in the correct position, you may end up fracturing a couple of ribs. And even so that you're doing it in the correct manner, you still are able to break some ribs.
Especially on someone who may be small in frame or an older individual.
Older individuals, persons with certain bone diseases as well.
So we know that's a consequence of CPR, but I'd like to back up a bit though. Individuals who don't know how to perform CPR, I won't even go down the road of whether they know how to do it correctly or incorrectly, but just knowing how to do CPR first and foremost. How do you think we can correct that?
With training, community education, awareness, going into the communities, training individuals. They have several organizations that do that. You have the Red Cross, you have St. John's Ambulance, you have EMS, and you also have the American Heart Association. So there are many agencies that do have these programs that individuals can learn and perform these skills.
May I ask, what have you done to?
Well, for me, per se, I have worked with a lot of church groups and so forth, community-based groups, teaching them first aid CPR courses.
A lot of attention many times is placed squarely on CPR. And we recognize, and as we started off the discussion, that because cardiac arrest is such a major problem, that it is vital that people know how to do CPR.
Yes.
But do you think we all recognize that there's a difference between CPR and first aid?
That's one of the things. People think that when you mention CPR, you actually, first aid somehow becomes just a part of it. First aid is a different, a whole lot of other aspect of it. You're talking about bandaging, splinting, how to treat a person with certain medical conditions, and that's what first aid is all about. With BLS or CPR, we're talking about doing chest compressions, ventilating that patient, try to maintain life for the first couple of minutes until advanced help arrives.
I watched a powerful video the other day, and you mentioned St. John's Ambulance, and it was actually, if I'm not mistaken, produced by St. John's Ambulance. There was a cancer patient who had been diagnosed with cancer, had gone through all the treatment of cancer. Now cancer is in remission, he's doing well. The family has a barbecue to celebrate. He has a bite of a hot dog and chokes and dies because nobody knows how to do first aid or knows how to do the Heimlich maneuver or any of those things that would have ideally been taught in either a CPR class or a first aid class to help resuscitate. In your professional experience, have you seen things like that happen?
I've heard of incidents or instances where people are at functions and simple things happen in the daycare, for example, and that's one of the things that you find that persons who operate daycares, they don't know first aid or CPR. And I can remember a few years back there was a case that a child had swallowed a marble of some sort and nobody knew what to do. And they called, from what I understand, they called 911 and they all stood there until the ambulance arrived.
On the scene, on these scenes, you mentioned that these individuals don't know, but what about on the street when there's an automobile accident or a drowning victim? What is being done to ensure that these people can be resuscitated, or is anybody doing anything?
Well, what you find a lot of good Samaritans. People want to help, whether they're doing it the right way, they tend to just go and assist.
Right.
And sometimes that is not the best, especially when it comes to motor vehicle crashes, where persons can have spinal injuries and so forth. They got to be moved in a coordinated effort, and that's where additional training, especially in first aid, and even a bit advanced than first aid as well, that these individuals can get this additional training to know how to move these individuals when it comes to cardiac arrest, even drowning patients, near drowning patients. There are particular skills that you have to utilize to move these patients as well. The first aid issue is a more broader topic than CPR itself.
It really is.
It really is, because there's just so much more you can get into with first aid than CPR. You know, CPR, you're doing chest compressions,
Right.
airway management and so forth, but when you're talking about first aid, you can go from basic first aid to advanced first aid.
True, because there are different levels of training. Because then it moves not just from knowing first aid, but also first responder.
First responder as well, and that's where individuals, when it comes to motor vehicle crashes, they have to do an additional training than just basic first aid.
Do you think that's why people, when they do come across a scene, they don't do anything because they think, oh well, I'm not EMS, I'm not the first responder, I'm not supposed to do anything, I'm not supposed to assist?
Well, you know, there are basic skills that are taught in first aid, that simple thing that you can do until advanced help arrives. Just hold a person's head in a stable position until help arrives. Sometimes it's just to maintain that airway, open that airway using that head tilt chin lift maneuver, which is taught in CPR and also basic first aid. So there's simple thing that a first aider can do, and that's why you say you stick within your scope of what you know. And just simple things like that, they can just simply do a simple bandage, splinting.
Which is also why when these classes and or these training sessions are done, individuals are taught to call for help. In all cases, especially if you are not a medical provider, and even as medical providers, we're still trying to call for help immediately, but do what you can in the interim to try and assist the patient instead of standing back doing absolutely nothing.
Because what you're actually doing, you're trying to maintain life as best as possible.
Right.
Or sustain life as best as possible.
Because I think we've all heard of incidents. I remember there was one in front of Sandals, and then there was another one over here in front of the military base where there were extreme accidents and the public got upset at the people who stepped in to try and assist because these individuals had a bit of training and they were actually able to assist the victim at that point. Is it then, or are we then saying that there needs to be a paradigm shift in the perception that people have, that we need to be a society of people that are more willing to help ourselves, if you would, instead of just standing back waiting for people to come and do something when we can in fact do?
Yes, and you mentioned that one of the things that you find is that sometimes people are so busy that they tend not to want to stay around to assist. I got to get to work, I got to go do this, I got to go do that. So what you find is that they get frustrated when somebody stops the traffic and say, okay guys, you're going to need to reroute, or you got to wait until the ambulance arrives and as we treat this patient. And people get frustrated because of that. And I think, again, it goes back to education of what first aid is, what is CPR, basically what is basic life support, and what can you do to assist. Even so, you cannot assist in treating the patient. There are things that you can do, like the public, especially when it comes to motor vehicle crashes, is to stay at safe distances.
Right.
And simple as that, you're helping, because what it does, it prevents the emergency medical services, the police, the fire department. It gives them easy access to the victims. And what you find right now, what's happening is that everybody wants to zone in on that small area, and then the emergency vehicles, they're hindered in getting to that response area.
This is probably a touchy area, but do you think if individuals had some basic knowledge of first aid and CPR, that the minor issues or incidents that they have at home or at play won't necessarily take them to the emergency room?
It won't, because there's simple things that you can do at home, simple treatments, simple scrapes, cuts, burns, things that you can do to treat these minor incidences at home. But what you find, people don't know what to do. Again, it goes back to training, back to education. People don't know what to do, so they tend to flood the emergency department with some of these minor cases.
And by no means are we saying that people shouldn't go if they don't know, or that they should not go and see their physicians, because at the end of the day, if you have a doubt,
then you should go.
You should go. But the point being that a minor scrape, bruise, burn, or something like that, that if we at home had our first aid kits, we had our first aid training, then we would be able to ward off some of these things.
And it's all about preparation, being prepared. You know, people don't get a first aid kit because they think, okay, nothing is going to happen. You're at a barbecue, you're at a picnic, something happens, and you're not prepared to deal with that emergency or that minor situation because you're just not prepared for it.
So it just really gives us room for growth, so that we move from being reactive
to proactive.
Being proactive. Thank you very much. We'll be right back. Well, previously when we were talking about CPR, I don't want people to leave thinking that you can do CPR any kind of way. So in the classes in which we teach basic life support and our basic CPR, what's the hand position that we want individuals to have when they start the procedure?
All right, very good. So we're going to look at the chest itself. And as we see here, we see the nipple. We'll draw an imaginary line, and we go on the lower half of that breastbone. So we're just below the nipple line. So hand placement would be here and here, right on the sternum itself. And you want to compress at least 2 inches in depth. Right? So when you're compressing, you at least 2 inches in depth, which is going to compress the cardiac muscles, thereby causing circulation, perfusion to take place.
Why at least 2 inches?
What you find in the past is that persons tend not to compress the chest adequately. So hence, it does not create that perfusion, that circulation to get the blood to the brain and to the vital organs. So compressing the chest at least 2 inches, what it does, it creates, squeeze the heart and thereby creates that perfusion.
The circulation.
The circulation so that the brain and the vital organs can get a supply of blood.
Can remain viable, very
Yes.
good. Now, this particular guy that we're using here, he's on a soft surface. Would we leave him on this soft surface if we needed to perform chest compressions?
No, we would not. It would not be adequate. Hence the depth as well. That patient needs to be on a flat hard surface. If your family member, your relative is on a bed, the best place is to take them to the floor. If you're in a hospital setting, or if you have a device such as this hard board, you place it between the bed and the back of the victim. Okay, so if we just place this under. So now we have a hard surface in which to now perform CPR.
So now we've got the patient on a hard surface and or a family member. This hard surface allows us to now perform chest compressions to a more adequate degree, correct?
Yes.
Why is that?
Right, so with the chest compressions, the hand placement, we're talking about the depth of chest compressions, the rate of chest compression, which is 100 per minute, at least 100 per minute. Also, if we're doing chest compressions perfectly with the hand placement, with the rate that we're doing, we can only do approximately 30 to 33% of what the heart does. We are at that small end, 33%, which means we have to do it perfectly. Also, when a person collapses suddenly, in the first 2 minutes of CPR, the first 2 minutes of CPR is very important. Why? Because that person's heart is well perfused. That oxygen that is within that blood, we can circulate that to get it to the brain and to the vital organs. After 5 minutes, that percentage drops to approximately 40%. With the first 2 minutes, the survival rate can be approximately 70%. After 5 minutes, it drops to about 40%.
So basically the point that we're trying to get across is that if a loved one is unresponsive, time is of the essence.
Time is of the essence.
Calling for assistance, calling 911, the emergency response, to get someone there. However, in the interim, instead of standing by and doing absolutely nothing, we can at least begin doing those chest compressions properly in order to ensure that the person's vital organs remain viable while we're waiting for advanced life support to arrive on the scene.
Yes.
Very good. Yes. Again, in the past, there was always talk about the number of compressions versus the number of breaths. We know with the new revised guidelines, we're encouraged to focus a lot on the chest compressions to keep the heart, the brain, the vital organs perfused while waiting for advance. Are we then saying that because such concentration is being placed on the chest compressions alone, that nothing needs to be done as far as providing breaths and keeping the airway open?
No, not at all. While chest compressions have been concentrated and very important, but the airway itself is also important because that's where the patient gets its oxygen so that it can get into the bloodstream to be perfused the brain and the
But I'm at home. I don't have the same stuff that you would have on an ambulance or that they may have in the hospital to try and help my family member.
Well, that's where we say when you go to a first aid class, a CPR class, we also teach you that prevention is better than cure, and also to be prepared. So we have a couple of devices. This is called a mask, okay? And this is one of the devices that can be used to ventilate your patient. It goes around the victim's face, and you can give your breath. thereby protecting the victim from you and you from the victim. Also, we have these nice little keychains. In it also have a barrier device as well. Again, it's also used to protect the victim from you and you from the victim. If the individuals at home were prepared, we would have these devices in our first aid kits, in our CPR bags and so forth. So it's all about being prepared.
So it's not to say that these are just things that are being used in the hospital, but as you said, we can keep them in our homes, in our vehicles, so that in the event, God forbid, anything does happen, we have the necessary equipment to actually
start care while we wait for advance.
What's the ratio now as far as compressions to breaths?
The ratio is 30 chest compressions to 2 breaths. For an adult, 30 to 2. For a child, it remains 30 to 2. Infant, 30 to 2.
And I'm glad you went down the road with regards children and infants, because we have this adult simulated patient, but at the same time, as parents, if we know these things ahead of time and if we're prepared, in the event that our child has an episode, then we're able to assist them as well. Because you correct me if I'm wrong, but one of the greatest incidents that we have with young people has to do with whether it be choking or some type of respiratory distress. And when they can't breathe, then the next thing that they go into is cardiac arrest. So it's not to say that only adults have cardiac arrest, but young ones just as well can go into cardiac arrest.
Yes.
Advice, suggestions that you have for the community as far as what they can do to prepare themselves? You've used that word several times, to be prepared. What it is that they can do in order to be prepared?
I must say, first thing I must say, take a first aid class. Take a CPR class. Go to one of these
I missed that.
look in the camera. Right. So the first thing that I would say is that they must take a first aid class. Take a CPR class to be prepared. That's one. When you have completed that class, don't just take that card and push it in the back of the pocket or in the wallet. When something happens, you try to assist. That's one of the biggest issues we have in Antigua today. People tend not to assist. Something happens and they say, okay, you know what, I'm going to cause further harm to this individual. Let me just stand back. But no, assist, because your assistant may be able to help preserve life of an individual.
And the life of a family member.
A family member,
it may not
loved
be
one, a child.
Exactly.
Okay. Other than that, I will say, encourage individuals to take a class as well. Encourage individuals to take a class as well. And be prepared. Ensure you have a first aid kit. You have picnics, you have barbecues. Ensure that you carry a first aid kit with you to these events. Ensure that every individual has a first aid kit at home. Things happen at home, in the home, as it happens out in the community as well. So we also have to be prepared that at home we can treat these minor cases as well.
Fair enough. Marlon, we could stand here all day and talk about not just CPR, but various aspects of first aid. However, an issue that comes up quite frequently are with regards, let's say, seizures. You have individuals because of diabetes they may seize, or young ones they may seize. What's kind of a take-home message then that we can send with the viewers as far as things that they can do in this case, seizures, for example?
All right, so one of the things, first thing is to do is to ensure that your safety comes first. Also the safety of the patient, which means if the person is in an area where things are around them to damage them, just remove the objects from around them. Another thing is, do not put anything in the sieging patient's mouth. From time to time, what you find is that persons will put spoons, piece of wood. And what
Fingers.
a finger, even try to stick their finger in because that person is biting up their own tongue. And what you find is that a person who's having seizures have enormous strength. And what you find, they're clenching down on that object that you have just now put in their mouth. They have a tube that is loose, it's out, it goes down, it blocks the airway. That piece of wood that they're putting in the mouth, they bite a piece of that off, it goes down, it blocks the airway. So instead of having a patient who is seizing now, you end up having a patient with an obstructed airway, a foreign body obstruction airway. And that's one of the two things I think people should know. One, ensure the safety of the patient and themselves, and do not put anything in the victim's mouth.
Good tips, good tips. Cardiac arrest, respiratory distress, seizing or seizures, these are common things that we find in our community on a daily basis. We cannot forget and or overemphasize the importance of, if you're at home, if you're outside or in a pre-hospital setting, to call for help, because that advanced care is needed. However, at the same time, don't just stand around and do anything. But educating ourselves as a lay individual on the various techniques can help to increase the survival rate, if you would, of our loved ones or people in the community. However, education is ultimately the key.
It is the key. It is the key. As long as you have that, there's so much that you can do. You can help an individual who's in a motor vehicle crash. You can help your family members, your loved ones, at a barbecue, at a picnic, somebody who's choking.
On the beach,
drowning. Or drowning victim as well. These are some of the things that you can do as long as you are educated. You take these first aid courses, these CPR courses.
Very good. Thank you, Marlon, for taking some time out of your busy schedule. We look forward to having more of these discussions, and thank you for being with us on your first visit to Healthy Perspectives.
Thank you very much, sir.
We'd like you to take away from today's discussion the fact that while we may attempt to maintain safe practices at work, home, and at play, things happen. So once injury or sudden illness has occurred, effective first aid and or CPR can be the difference between a rapid or prolonged recovery, the difference between a temporary or permanent disability, or the difference between life and death. Honestly, if that isn't motivation enough to make sure that you, your family, and your friends, your employees are first aid and CPR trained, well, I'll leave that up to you to consider. We thank you for spending some time with us and for allowing us to share healthy perspectives with you. Be well, Antigua and Barbuda. May your perspectives always be a healthy one.
Healthy Perspectives, an AUA ABS initiative offering you a positive view on health.